Good morning, everyone. Welcome to today's PAI Catalyst session. My name is Smita Gaith. I am the Associate Director of Communications at PAI. Thank you so much for joining today's conversation between Dr. Samu Dube, Executive Director of FP2030, and Nabeeha Kazi Hutchins, the President and CEO of PAI. This discussion comes at a critical time for family planning and reproductive health, and we hope you're going to be inspired and motivated by what you hear today. We also have Yewo Gondwe from Malawi, who will join us during a portion of the conversation, and we're really appreciative that she has joined us today, so thank you so much, Yewo, for being here. Before I hand it over to Nabeeha, I just want to share a few housekeeping items. First, this session is being recorded and it will be shared with you. There is a Q&A session for the later portion of the discussion, and we invite you to post any questions that you have via the Q&A function for Nabeeha or Samu. We also would love for you to engage with each other and us in terms of questions and comments using the chat function, and we'll have the opportunity to talk about some of what you share, some of your insights, what's top of mind for you throughout the session today. And we encourage you to connect with us and amplify the conversation on social media. We're on X and Instagram. You can use our handles PAI_org and FP2030 Global. And feel free to use the hashtag PAI Catalyst and hashtag Made Possible by FP. We'll share those handles and hashtags in the chat later. And last but not least, if you have any technical issues, please feel free to message us using the Q&A function. Thank you again for being here. And now I will hand it over to Nabeeha Kazi Hutchins, President and CEO of PAI.
Thank you so much. Greetings to all of you who are joining us today. It's really such a pleasure to be together. And for those who may not know us, PAI is a civil society organization. We're based here in Washington, D.C., and it's our 60th anniversary this year. For 6 decades, we have been champions for choice. And it looks like my camera is off, so hopefully I'm on now. So as I was saying, it's our 60th anniversary this year, and for 6 decades, we've been champions for choice. We've been calling for the right for all people to access quality sexual and reproductive health care and services on their terms, and of course, always with compassion and dignity. We advocate to and hold our own government in the United States accountable to advance critical policies and funding for family planning, maternal newborn health, and reproductive health. We steward and amplify a range of coalitions. We also amplify evidence and calls to action to reach those who have a consequential impact on the health and vitality of communities. And we're especially proud of the fact that we are not only part of expanded civic space, but also supporting civic spaces for SRHR advocacy around the world for over 30 years by funding local partners, stewarding and providing technical assistance to global, regional, and national coalitions, and also building dynamic advocacy and accountability partnerships to ensure that SRH is delivered and not denied. We're especially proud of our global partner network. So many of you are joining us today of over 1,000 local organizations across more than 33 countries. And also, again, thankful for the collaboration with so many of you who've joined us. I welcome all of you, and I thank you for your voice and your commitment to our shared cause. So as Smita was mentioning, today's Catalyst session comes at a time of great consequence for global reproductive health and rights. We're seeing significant funding shifts, political transitions, and shifting priorities. We know that communities and countries are crushed by the debt burdens. There are ongoing pressures related to crises, conflict, and climate emergencies. And we also know there are vibrant global, regional, and national movements that really seek to disrupt and dismantle some of the policy, legal, and health systems gains and achievements for SRH. And at the same time, there's a lot of opportunity for us to protect those gains, to really coalesce in inclusive and deliberate ways around advancing access to reproductive health, to leverage our institutional strengths and keep amplifying the impact of the investments that have made so far to date in SRH, but also the impact of ongoing access to reproductive health care and what that impact means for economic achievement, for gender equality, for for education gains, certainly for resilience building in the face of so many crises and so much more. And we also know that sexual and reproductive health is a best buy. We know the economics behind it, and we know that it saves lives. We know that it is core to really enabling the progress on a range of development fronts, and more importantly, it's a fundamental human right. So in this time of great shocks to the health and development space, we must hold on to our gains, be bold, and keep advancing the additional ambitions that we envision and ensure that we're standing together as bold champions for choice and rights. And among those champions is Dr. Samu Dube. And I'd love for Samu to join us on screen. So it is my great honor to introduce my friend and my colleague, Dr. Samu Dube, who's the Executive Director of FP2030. She's a physician and a global health leader with more than 2 decades of experience spanning healthcare delivery, policy, financing, and innovation across Africa and around the world. Before she stepped into her FP2030 role, she held senior roles at PATH, Afrocentric Health, Royal Philips, and others, always bringing vision and integrity to complex challenges. She's trained as a medical doctor at the University of Zimbabwe with advanced degrees in public health, finance, and business. And Samu embodies the technical excellence, the courage, and compassion that our field demands. But what I admire most about my dear friend Samu is that she has deep humanity and has a steadfast commitment to ensuring that women and girls in communities everywhere have access to the resources and the rights that they need to thrive. And so it's with great pleasure, Samu, to have you. Hopefully we have her on video. Great. So Samu, we're moving early in Washington, D.C., and I know you love to move. Did you do your run this morning?
Of course I did. And it was so early, Nabeeha, but I had to just like squeeze 30 minutes of a run in. I love to do that. That's what keeps me alive and engaged, Nabeeha.
I love it. I was telling somebody, we spend a lot of time this summer, and over the years together, I joke, I'm like, Samu and I should just be roommates. But whether it's London or Sevilla or Rwanda or Tanzania or here in DC, you go for that run, rain or shine. If it's raining and I have my workout shoes on and someone puts a delicious treat in front of me, I'm not working out. But no, where's Samu on rainy London morning? Oh, Samu's out running. So you, my dear, are an inspiration and an example to many of us.
You are an inspiration at PAI, and congratulations on your 60th birthday. Well done.
Thank you so much. Thank you, Samu. So this conversation has been a long time coming, and I always like to start PAI's Catalyst sessions and ask our guests about their own journey. And you have brought so much to advancing the priorities for women's health and advancing the mandate for FP2030 and our shared ambitions for family planning access. So take us back to what motivated you to take on this work.
Thank you for that question, Nabeeha, and good morning, good afternoon, good evening to those who are going to be listening to this Catalyst session. Nabeeha, when we talk about reproductive health, it's basic, right? It is basic. When we are trying to advance women's lives, when you're trying to advance economies, when we are trying to ensure that families are resilient, it actually starts with that most intimate part of a human being. And for me, that is reproductive health. I've always been driven by that belief that for you, and like access to family planning is just fundamental to dignity, is fundamental to opportunity. Look at how many lives get derailed or trajectories changed because people did not have access to information, access to products and commodities, but even access to that service delivery model that enabled them to make that choice. So for me, that is what is driving me. And Nabeeha, I come from a part of the world where I've seen many young people, maybe even including my close family members, whose lives have been derailed because they had that unintended pregnancy, that some even died because they couldn't access safe abortion services. There are many things that happen around family planning. So why don't we just make this accessible to everyone? It's just as basic as that. So that's what drives me, because for the world that we want, and certainly for the Africa I want, I do believe that it's basic for where we want to go as a continent and as a universe.
I so appreciate that, Samu. And, we've talked about this piece in terms of access and what are the barriers. And I would agree with you. I think there are many things that are frustrating and infuriating, but I always say, regardless of what sector you're in, if we have tools available, if we have innovations available, if there is tried and true and trusted knowledge available, and for that to not be accessible by communities who stand to benefit the most is an incredible injustice. So I know you're working to fight that as we are here at PAI. So Samu, the other piece I wanted to talk to you about is we, of course, have seen so many different angles of efforts to advance the family planning agenda. What do you see as really standing in the way? And also, what are the bright spots that we can better leverage as it relates to increasing access and breaking down some of those barriers?
Thank you for that question. And in this fight for the fight for family planning is a fight for equity, basically. And what we are now up against, Nabeeha, is not only the movement that is kind of anti-rights, anti-choice, because we are coming from an era where, both the feminist perspective around family planning really sort of converged with the developmental perspective. And many governments got it because they were like, we are going to have the demographic dividend. And they really embrace the idea that family planning is actually a basic right. But where we are in 2025? Amidst funding shifts globally around for ODA, as you know, we are challenged about resourcing this basic ask. The second issue around the rights, anti-rights movement that has been growing over the years. Some of it has been growing under our radar, but right now it is overt. It is actually overt. It is spoken about in pulpits. It is spoken about in policy circles, that we actually need more people and therefore we should be anti-family planning. But that's not what it is about. Family planning is not about population control. It is about the ability to make a decision about when and how many, and perhaps with whom you want to have children. And then lastly, we are also seeing cultural norms that have been prevailing for a long time that are taking us back. And people are, in a conservative circle, you want to go back to what was maybe 100 years ago. But Nabeeha, you are not there. You don't understand what was happening 100 years ago. So how far do we go back to that circle of the life that was once ours? So we are seeing cultural shifts that say, let's preserve the status quo. And that is concerning. Those are the main barriers. But you asked a question about some of the bright sparks. Do you know, I recently was in Fiji and I was encouraged by what the government, the government was like, I don't care that we are 1 million. I don't care that we are few. We are going to ensure there is reproductive health access to every woman in Fiji. That encouraged me. So we are seeing some governments that are really advancing policies around access. But we are also seeing, amidst these funding shifts, many African governments are actually saying we need to prioritize the best buys of development, and family planning is one of those best buys. Rwanda, for example, the shift around access, we are really welcoming that because they are shifting access to young people, and we really acknowledge that. The last one is maybe sparks that have been in existence for a long time, such as in Guatemala, where we know that the government actually almost ring-fenced some of the health taxes for family planning. Isn't that wonderful? And it's obviously a lift to borrow from around where to right now, given the ODA cuts that we are seeing.
That is so inspiring. I think so important for us to always remember that while there are great challenges and there are great threats, at the end of the day, we do have those bright spots with governments and civil society and coalitions in countries across Africa, Asia, and Latin America who are still prioritizing family planning, who are still saying, look, the landscape has shifted in a way that could be devastating and is very consequential to the broader global health and development space. But our commitment and our resolve to ensure that family planning and other key services remain. But I think it also comes to the point that we've talked about before as well, is we have to keep the drumbeat going, and we have to stay in front of these conversations and at the table with individuals who have the power to make funding decisions and policy shifts. So I would like to talk about FP 2030, and then we do have some other exciting things to talk about regarding the incredible campaign that FP 2030 is stewarding. But back to FP 2030, and for our guests, you know, FP 2030 and before FP 2020 and PAI have what I like to perhaps describe as a symbiotic relationship, a strongly aligned relationship, going a little bit back into the history books with FP 2020 and FP 2030, really focusing on building the political will and family planning commitments with national governments around the world. And then PAI with the complement of our civil society network really serving as an independent accountability and advocacy mechanism to not only demand that commitments be made and that governments are held accountable to deliver on those policy and financing commitments, but also being at the table to co-create those commitments for many countries for FP 2030. For example, what we partnered with in Chipta in Indonesia, or Sarak in Bangladesh, Korha in Ethiopia, Samash in Uganda, and so many more. So, you know, perhaps we could level set and ensure that we are all launching from the same place today, and tell us, what is FP 2030 and what are the priorities moving forward?
Fantastic. Thank you for that question. And thank you for even highlighting that it started as FP 2020. So FP 2030 is the only global partnership that is focused solely on family planning. And you know, Nabeeha, what we are trying to do is build a world where everyone everywhere has the power and information that they need to make decisions about pregnancy. And we've got various priorities there. A world where everyone, everywhere, has that power and ability to make decisions about, you know, their reproductive health and rights, deciding when and if and how many children they want to have. And I think within that, we do embed a strategy that looks at where is the evidence that what we are driving at a country level, at a regional level, at a global level works. So we mobilize funding and political will for this particular mission at a country level, and we're trying to build global solidarity, of which, you know, Nabeeha, I'm so grateful for PAI for helping us even in building that global solidarity. Because when you look at family planning, as you and I know very well, it matters whether you are here in Washington, DC, or whether you are in Mali, in Bamako, it matters everywhere. And that global solidarity is important. So how do we ensure that we build solidarity that really has some avidity and staying power? So what we also do is promote data and evidence and high impact practices. We know there are things that work. As you spoke up examples in Indonesia, we know what has worked there, and we know what could work in Morocco, what could work in Tanzania, and we could borrow lessons across the field on what works and share those lessons across the board. So it is part of our strategy of countering anti-rights, anti-science by bringing in evidence and showcasing evidence of what works globally. We also expand the tent, and I think I like that. And thank you so much for this catalyst session, because we want to expand the tent of supporters. We want to expand the tent of champions and partners across the world who will believe and invest in family planning and enable it to happen at a community, at a family level, and at a country level. And we don't want to just be speaking amongst each other. You know, you and I, we talk all the time, but you want this message to actually permeate across even the barriers that we are seeing every day, so that everybody is aware of what family planning can do in their families. And lastly, and I think what I'm excited about is that, you know, Nabeeha, the world does have so much money. Do you know that? Except
It
that
does. Samu has a lot of money.
I know they do have, but can they fund family planning programs? So we are looking at new financing solutions that can help countries and communities have this ability to invest in this global good, globally, and want to encourage scale-ups of programs that work where we can. In Nigeria and in Ethiopia, we're working with local partners to ensure scale-up of programs that work. And there are technologies that we would love for women to have access to. For example, self-care. How do you ensure that this is available globally? So that's actually how we work. And replicating, in other places in the world, the example that I alluded to on Guatemala, could you get that example and see whether Senegal or any other country could emulate health taxes as a way to fund reproductive health? So that's what we do as FP2030, and we really are proud to partner with PAI in advancing these causes.
Yeah, this piece on the funding, and there is funding there, and the question for me is always, well, why wouldn't you fund family planning and reproductive health when we know it's a best buy? We've talked about, for every dollar invested in family planning, you get $7-8 return on investment. We know what it does to reducing anemia rates in children and low birth weight when women can space their pregnancies appropriately. We know what family planning does to reduce maternal mortality and morbidities. And so the question is, why are you not funding family planning? Why do we have to continue to case make over and over and over again when this, for many of us, and I did not come from the SRHR space, I came from HIV and nutrition and agriculture, but for me, it's a no-brainer that this is foundational. So I think, you always encourage to be bold with the ask and think big, and I think we have to ask the question of those who have the resources, say, well, why are you not doing this? So, one of the reasons I wanted to have this conversation with you, with our community, not just one-on-one, but with our community, is precisely because there is a new campaign that FP2030 is stewarding. It is intended to elevate the importance and the impact of family planning, which is the Made Possible by Family Planning campaign. Tell us about it. What inspired it? What do you want to achieve with it? And then I know we're going to show a little bit of a video to share the campaign, but over to you, Samu. I'm very excited about this.
Thank you so much, Nabeeha. Made Possible by Family Planning. I think that's the message that we're trying to get to those who do have the power to fund, right? Those who have got the power to make decisions so that they see, intricately, what can be made possible by family planning. So this is a community campaign that has got three main objectives, Nabeeha. We spoke about money. We are hoping that through this campaign, the message will really land on why we need to finance family planning. So one of the objectives is to increase funding for family planning programs across the various spaces where money is needed. And we also want to change the narrative around the issue by building new champions. And so far, we are working with 8 influencers across the globe. We have got a reach that is nearly even 1 million followers, to change the narrative about family planning. Family planning, when somebody gets an implant, they are not getting it so that they don't die. They are getting it so that they can have autonomy, so that they have choice, so that they can do more with their lives. So how do we change that narrative to say family planning just can give you so much more in terms of opportunity, in terms of choice, etc.? And we're also trying to catalyze new FP2030 commitments. Since we started this campaign, like this time last year, through the campaign, we've had more than 60 commitments and so many stories of people telling us what can be made possible and what has been made possible in their lives through family planning. It was actually conceived before the recent events that we saw, like the reduction of ODA in this community-led, where the community was like, let's do something. in the family planning space, but we are always listening to the community on how we can fine-tune these activities that I've highlighted and how we make it better, which is why this conversation is timely, because civil society and people who are coming from many countries, I'm seeing DRC, I'm seeing Senegal, we are hoping that the message will then get through. You know, Nabeeha, we launched our campaign because our sector needed something to bring us together and mobilize with a clear direction of travel. And we are advocating for increased funding for the community with the idea that we can have all boats rise, because the rising tide can lift all boats. And I also, I believe that there could be new funding for this community. And this issue is a win for women and a huge achievement for us all. That's why, for me, it's a community-led campaign. And we linked the goal of new money because there is need for also new leadership and we also new voices. Recently, when I was in Kenya, I was privileged to see people who were in 94 Cairo, some even predating ICPD meeting in Cairo, you know, having a conversation with those people and looking at their hearts and the intent that they had back then and saying, okay, I have carried it forward. We want to do the same in this movement to ensure there are new voices, there are new players who will continue not only this fight, but also carry over and remain steadfast with the wins that we already have to date. I think from International Women's Day, from many of the platforms that we have held, we know that family planning is a winner. And Nabeeha, you know what? I actually trust women. You know, women, when they know that they can decide, I trust them that they do not go back.
I completely agree. Well, let us play this video.
Right.
What is at stake when we cannot control our lives? As a young single mother in Nigeria, I understand that I am privileged to have access to family planning. Without this, it would have been financially strenuous for me as a young single mother. Family planning isn't just about having kids, it's about planning for your future and deciding when and how you want to live your life. At 25, I am deeply immersed in my passions: singing, acting, content creating. My journey is made possible because I had the power to choose my timeline. I'm a business owner and a mother of two beautiful boys. Having the access as to when we wanted to have children helped us ensure opportunity and possibilities.
I've always had a desire to have a child, but also always had a desire to have the career that I've always dreamed of. And I knew that if I planned things accordingly, I could have all of those things.
There are many things we can't control. Through planning, I'm able to do all the things I need to do for my family.
These stories aren't rare. They reflect what's possible when family planning is prioritized and accessible. When women have access to family planning, they can pursue education, careers, and entrepreneurship, strengthening economies. The ripple effects last for generations.
It means that women can invest in their family's well-being, young girls can stay in school, and industries can benefit from the contributions of more empowered women.
Planning your life shouldn't be a privilege, but for too many, it still is. Funding for family planning is under attack. Rights are being rolled back. Progress is at risk. Family planning should be a basic right accessible to all. At a time when family planning is under threat, the urgency to act has never been greater.
No one should be denied the ability to safely plan their future.
Let's make that possible for everyone.
Share your story today.
Raise your voice.
Amplify the message
And let the world know how important it is to have access to family planning.
Stand with us. A brighter future for all, made possible by family planning.
So well done, Samu. And it's very powerful to be able to hear of some of the testimonials and some of what has been made possible by family planning for those who are in this video. And I know, those who are featured are individuals whose lives actually have been changed. You know, these aren't just spokespeople. It's women and men and families who believe in this and have recognized that their achievements and their ambitions have been made possible by family planning. So it surfaces also that human element, the human impact of family planning. I'm curious how you see the campaign shaping political conversations and funding decisions, especially in this climate, as we've talked about, of budget cuts and political interest shifting and so on and so forth.
So, Nabeeha, I am hoping that the campaign, through these stories that you've just heard, this is just a teaser, by the way. There are many more stories that the team have been collecting over the months. We are hoping that these stories would actually not only touch hearts and people who have change of mind around prioritization. So we believe that if a story can, because a story is a perspective that shows a different side that numbers can't. When you wake up and you hear about maternal mortality, about, unmet need, etc., it may not touch your heart. So we are hoping that the campaign could actually change that particular narrative. We are also hoping that people would see science for what it is, because we know family planning works. We know what family planning can do in a person's life, in a country's economic trajectory. We know what family planning can do. And this campaign would really zero in on what family planning has done for economies, so that in these times of austerity, in these times of funding cuts, we would actually rethink what really are our best buys. When you have to budget $40 per capita, $60 per capita, how do you prioritize? You need to prioritize not just with what is urgent, but also what is important and likely to give you the best returns. So it is our hope that through stories that we are seeing today, we really can remind leaders what's at stake.
So Samu, let's talk about civil society. And how do you see the Made Possible for Family Planning initiative or campaign being embraced by civil society, and how can organizations in civil society engage and participate in it?
Thank you for that question. And thank you, Nabeeha, that even PAI is already engaged. So what PAI is doing today is part of the solution. We are hoping that civil society could advocate wherever you are for increased funding for family planning programs, and ensure that this is actually high up on the political agenda of your country, because it works. It is one of the best buys. So if you are already doing that, you're already engaged, you're halfway there. So we want to thank you, because this campaign is primarily about getting and ensuring that there are new people into the fight. So civil society is one of those. We would also love civil society to show up differently. I think our sector, because we are coming from environments and we still exist in environments where resources are limited, let us not eat each other for breakfast. Let us show up differently for each other, because many things are at stake. Engage in new events, with new audiences, bring them aboard because of course, that may look different depending on who you are, because that is important. Now, for those of us who are still in this movement with us, Nabeeha, political leaders are forced to ruthlessly prioritize. It's often easy to say, I need to make sure HIV because there's going to be resistance, etc. But I believe there should be intelligent formula on reprioritizing activities and allocating funding wherever we are. So civil society, when they are aware and they are familiar with the family planning story that is about every woman's health and family planning is a priority, they are going to make sure that is prioritized in budget cycles. And yes, we do need new people to join the fight, and we are asking those who are already in the fight to fight like hell for family planning to remain in budgets.
So important. When we were at the Financing for Development conference in Spain this summer, Samu, there were many conversations about what is the funding architecture going to look like. And I know this is a conversation that our sector has had right out of the gates this year, is what does the architecture look like for family planning and reproductive health? And, we're, of course, having a lot of conversations with many of our partners, ensuring that those priorities are not, and the architecture and the blueprint or whatever it ends up being called is not defined by global North institutions, or European institutions, but that actually needs to be defined. This is the moment by organizations that have been doing this work in their countries, holding their governments accountable, with civil society at the forefront to inform what is the way forward for the sector. Not assuming everything is lost, but what do we prioritize and why that matters. So I'm excited to hear you say that as well.
Indeed. Indeed, Nabeeha, and actually PAI is at the center of this. I just wanted to also pose that question to you. Like, PAI for a long time has been an important partner and leader in reproductive health. Like, what impact do you think that this campaign could have in shaping this architecture, for us to define what that architecture looks like? How might your team, and maybe even yourself, how could you use your own civil society networks to shape that architecture, or to even leverage this campaign?
Thank you so much, Samu. And yes, we are standing with this campaign. We feel we're a part of this campaign and that it is absolutely critical as we continue to case make. I think there are a couple of things, while there has been so much evidence and ongoing case making around the innovations and the technical inputs and why this investment matters, we oftentimes, and I don't mean this as any type of criticism or deficiency of our sector. I think those in public health and development, we automatically go to the evidence and the technical component of this. But what I love about the Made Possible campaign, it is really highlighting the human element and starting from that perspective. And that, for me, I think in terms of how we mobilize a civil society, we continue with the advocacy, we continue with the accountability work, we continue to case make so that domestic resources for family planning and reproductive health remain in the line items. So all of that continues, but this brings a freshness to the voice. It allows us to go in with a community and that broad tent to say, ultimately, this is about people, and look at the incredible things that are possible. And this is not new. It's made possible for decades for those who've had access to it. So I think it allows us to start with the people story first, and then we get to how then is how do we make family planning possible? Because family planning makes so much possible. And it is a rallying cry. It brings us together. So I'm very excited about it. But thank you for that question, Samu. We know that this campaign is about activating change, and there are some inspiring ways that civil society partners are already taking this campaign forward and making it their own. And I think this is a perfect segue to invite our incredible advocate and champion to share a bit about how Made Possible is being adopted and embraced by civil society. And so with that in mind, I'd love to introduce and welcome Yewo Gondwe. And so she will hop on video. She's from Malawi and was co-founder or is co-founder of Life with a Purpose community. And as we were visiting, she also is the regional coordinator for the Movement for Community-Led Development, an organization that we both are very close with as well. And then, of course, she's the Family Planning 2030, the FP2030 Youth Focal Point from Malawi. So it's so nice to see you. Thank you so much for joining. And I guess I'll just start with telling us a little bit about yourself and your organization, and what are some of the issues that you're focused on right now?
Thank you so much, Nabeeha and Dr. Sam. I'm excited to join you and share my experiences in SRHR advocacy. So first of all, I'd say in my organization, with the current landscape, the global landscape, with the funding cuts, I think one of the key issues is to focus on community-based SRHR service provision. So I've been advocating for SRHR community-based service provision, as well as funding for SRHR, particularly the domestic funding. So Malawi being one of the countries that is donor dependent, I think we are in a crisis and we cannot be able to achieve sustainable change if at all we are not finding innovative solutions towards addressing SRHR issues. Yeah, so basically we are into that and influencing the policies into action and practice.
Thank you so much. Could you talk a little bit about how you have leveraged or integrated the Made Possible campaign through your advocacy work? What have you done, and how has it been received?
Okay, great. So after we had the orientation or the introduction to the campaign Made Possible by Family Planning by the ESA Hub, I took an initiative to also scale up the campaign to youth-led organizations in my country. So we have been mobilizing about 50 youth-led organizations across the regions in Malawi to understand the current status of SRHR and the action they need to take in order to address some of the gaps that we are facing as young people, particularly young people. So I'll be speaking on youth perspective. So these youth advocates have really been doing a great job. So we came and developed an advocacy roadmap to say, with all these challenges, what are we going to advocate for to ensure that these gaps are addressed? So we prioritize domestic financing as a key advocacy priority area. We also prioritize community-based SRH service provision through the youth community-based distribution agents. But also we prioritize the third advocacy issue was prevention of commodity stockouts and supplies. So we wanted to prevent that by engaging duty bearers at different levels. So these youth advocates across the country have been engaging district level duty bearers, including the Director of Finance and the Director of Health and Social Services, to advocate for having a proper allocation. For instance, I'll give an example of Mzuzu City. So they have been advocating to say the district city should allocate 1% of the city council budget towards SRHR, because what we noted is that SRHR is not prioritized as a key development issue compared to other issues, and it was missed out. So we wanted the district level councils should be able to also prioritize and include in their annual budgets, as well as their district implementation plans. They should be able to prioritize SRHR. So we want to shift from the donor dependent to now using local resources to support family planning and SRHR for youth. So basically that's what we have been doing.
It's so inspiring, and thank you for that very specific example. And I know that Malawi has elections this month, so I know you all are working very hard. But just on that, not to make this a political conversation, but there's always transitions and new priorities that emerge whenever there is a transition in government, or even if the same existing government stays. And we saw in 2024, more people went to the polls around the world than ever before. It has been a time of significant political change. And how do you see the Made Possible campaign and what you've already achieved with it really influencing that these investments continue, that family planning is prioritized and remains part of the core development agenda for Malawi?
Thank you so much, Nabeeha. Let me say that I think at this point, as youth organizations and other civil society organizations, we need each other as much as possible. We need to take the collective action towards addressing these gaps. And let me say it here that we are already, I was part of the, what we call the National Collective Advocacy. So we were engaging political parties prior to the voting. We'll be voting in 2 weeks, I'd say, 16th September. So we had engaged political parties, the 5 big political parties here in Malawi, to prioritize issues of adolescents and women health, particularly SRHR. And let me say it here, it was sad to see the whole manifesto, not even a mention of sexual and reproductive health. So when we engage them, I'll give an example of UTM, United Transformation Party. So the movement. So this party had to also incorporate training of youth-friendly health services coordinators, but also construction of healthy facilities in their manifesto. So we are going to use these tools, the manifestos, to hold them accountable. So each party will be on their doors to say, you had committed to do this in your manifesto. What are you going to do to ensure that the adolescent and youth SRHR is prioritized? And for the larger party, which is MCP, they had prioritized to say they would want to establish a national health services fund. So they wanted to be mobilizing resources domestically that will be going towards health. So for us, we had also engaged them to say, let's also prioritize family planning within that health fund. So I think this is the conversation that we have started at national level. And at district level as well, the youth advocates, when they were engaging the district finance directors, they were also advised to say, can you come up with a policy paper or an advocacy paper which we should share with the new incoming political leaders that are coming. So the director is ready to support the youth advocates in the districts. As long as they compile that advocacy issue paper, they will be able to continue supporting them and continue with the conversations forward. So I think that's what has been happening.
It's such a powerful share that you've just given to us, because it certainly there's a campaign, we have messaging, we have data points, there's efforts by civil society and coalitions to continue to speak up. But this also shows the other very critical piece and the role of advocates and accountability holders. And the power of these initiatives is you're at the table also informing and bringing other leaders along and shaping the political environment for family planning. And they're listening because you are the voice of community. It's not a donor or a big entity coming in saying, we think you should do this. You are demonstrating the demand and desire for family planning and reproductive health care. I guess my last question for you is, what's your advice to other civil society leaders, to other youth leaders, not just in the region, but also around the world, who are saying, how do I engage with this campaign? How do I get started? What do I do?
All right, thank you so much. So I would advise them to just search, for instance, on internet, made possible by family planning, and just to have a look at the video that you had played earlier, but also just keep on engaging different civil society actors on the current status of SRHR and what all of us needs to do in order to address the gap. So I think it begins at individual level. You should take it up to say, let me be part of this campaign because we are at a crisis, and a lot of issues are still coming. Issues of climate change are still affecting adolescents and young people's access to SRHR, and more issues will keep on coming. So we need to be strategic enough to support addressing these issues. Let me give an example to say, for instance, for Malawi, adolescent birth rate, as I'm speaking, is at 32%, which has increased from the 2015 demographic healthy survey, which was at 29. And now we are going up. And so I think this is not just a figure. 32% is a big number. And let me say it that in rural communities, it's at 34%, which means that we need to be strategic enough when making our interventions. We should not forget targeting all people in all their diversities. We have those in the rural communities who are highly affected. We have the young people with disabilities. So we need, when we are having our programs designed, let's not forget to look at the intersectionality of a human being, but also just taking the human-centered approach. This is a human issue and it's a human right issue. So SRHR needs to be prioritized at all costs, regardless of the situation and the circumstances that we are facing. But also, lastly, I would say, let's come together, all of us, all stakeholders. I think the issue of working in silos is not going to help us. So we need to be working together as much as possible at all levels, at local level, national level, whether it's regional level and across all the levels. So let's come together and keep fighting. We're going to see the change that we want to see. Thank you so much.
Thank you so much, Ewan. Thank you for your leadership as well. I wish you the best and thanks for joining us.
Thank you so much.
Yes. Samu, we are going to take a few questions from the audience. So for those who have questions, this is your chance to put it in the Q&A and we'll get to some of them today. So while that happens, I want to pivot a little bit to the global moments that we're looking forward to, like the International Conference on Family Planning. Of course, the World Bank fall meetings are in October. The UN General Assembly with various high-level events are happening here in a few weeks in New York. And I'm curious, what do we need to be loud and clear about when it comes to funding political will and accountability for family planning as we collectively are in these spaces this year?
Fantastic question, Nabeeha. Thank you. And again, thanking your Grace for that, articulating what they are doing, causing maybe pain to the political parties around SRHR. So I hope that they will respond. So Nabeeha, these upcoming events they are important, especially in 2025, given where we've just come from in the last few months. One of the major issues that I wanted to just highlight is we should not continue to just speak amongst each other, because this moment actually requires formidable partnerships that may be outside who we know. I know we will text each other, Samu, are you at Anga? How many days? Let's have coffee. We will do that. Often we always do that. But I want to encourage everyone to also look at partnerships that are outside those people who we know. We will continue to make a case for funding. We will continue to make a case for investments in family planning. But I think that alone is not going to create the change that we want to see. Nabeeha, I learned something that is fairly obvious about pedestrian theory. So if your conversation is not going to change, the people who Grace right now has been speaking about in rural Malawi, if it's not going to change their outlook in life, their trajectories, what they are actually doing, what are we doing here? We need to kind of just introspect our conversations. It's not just noise that we need. I think just getting out of our echo chamber, thinking about that pedestrian out there and thinking about how do we partner differently is going to make the change. But I look forward to seeing many of you at Anga, and if you know people who may be outside our own chamber who we need to link up with, let's do those linkages. I recently was giving closing remarks at the Global Summit for Women in Berlin. These are CEOs, board members of listed companies talking about family planning. And in there, you could see that now we are out of our echo chamber. And they didn't know that there's so much unmet need. And there you're trying to activate new players. So I'm hoping that even at Anga, we could do the same. At ICFP, we could do the same. And even at the World Bank meetings, I am hoping that we can do the same.
Thank you, Samu. So important. Let's speak to others and read the room and make it compelling for them so they want to engage with us. Samu, back to the campaign made possible by family planning, really can help frame some of the narrative in these global convenings. And how do we leverage this so we are talking about not just the campaign and what it means and why it's important, but also integrating some of this as calls to action in these moments of action? What is the call to action?
So the call to action, you know, there are three things that we talk about. There is going to be the money call to action for people to help us in getting all boats to rise. And by the way, when we're talking about funding, we are not saying fund FP2030. We are saying the program and the organization that Your Grace is running in Malawi needs funding. And the call to action is, let's make sure that her organization can get funding. We want to make sure that the rural woman who she's talking about, or the young girl who makes up the statistic of 34% adolescent pregnancy, actually does get commodities. So that's where the funding should go. And it's not just funding for FP2030. Nabeeha, when we meet, let us follow up. I love to follow up. Let's follow up and partner. Let's write up that op-ed. Let's do the catalyst sessions. Let us ensure we can do more together. Follow up until change happens. But more importantly, your organization too, whoever is on the call, can make an FP2030 commitment, because through commitments, we are then able to formally follow up on what organizations could work on around this particular campaign. But also sharing your own story. Share your story, make it known, make it loud, so that people actually can see family planning from a different angle and perspective, and then they too can embrace it in their own communities, in their own families, and perhaps in their own policy frameworks on why they need to invest without faith.
Thank you so much, Samu. I would love to go to some of the questions that we have received, both in the chat and also in the Q&A. And if anybody has more questions, please post them in the Q&A portion. But the first question I'll share is around financial sustainability for family planning and reproductive health, and looking at some of the innovative financing mechanisms, the creative financing mechanisms, and also the role of social enterprises being alternatives to donor funding. So if you could address that a little bit from one of our colleagues who has posted that question.
Yeah, and it is indeed, we call it thinking outside the box, but maybe we should just remove the whole box, right? Because it has been removed for us. I think when we are looking at financing, Nabeeha, first of all, is the positioning of family planning at a country level. If it's that important, I believe when we work with governments and private sector, we can find solutions. That at least I know. But where you are working with governments and you look at the fiscal space, and it's not enabling you to do more, because USAID, as many people are saying here, has sort of demoralized, the departure has demoralized the family planning agenda. You need to look at innovative financing mechanisms. They're not new. They've been around for a long time. Looking at social impact bonds, looking at development impact bonds that organizations like TICO have been modeling in Kenya and in other places in the world. We could do more around that, but also looking at health taxes that a country like Guatemala is looking at. That is another financing mechanism. But I think where it matters most, and I'm going to highlight two areas. One is sub-national financing. I think for many countries, and for those of you who may be coming from Kenya, there could be so much money that could be unlocked at a county level versus at a state or federal level. I think if we look at sub-national priorities, where a county governor or a provincial governor is prioritized family planning, there could be more money that is unlocked at a district level or at a provincial level. And as civil society, let's have those conversations, because often money is allocated, but it's not released at a national level. So that's one issue that I wanted to highlight around financing. And the second one, Nabeeha, is around private sector. How do we partner differently with private sector so that there could be ways of ensuring commodities are available at a cheaper price that could enable service delivery models to be more innovative and also to even be financed? And also, when I'm talking about private sector in its entirety, I'm talking about insurance companies. They too should fund family planning, even from risk, not just savings. it should also be from risk. And when we expand that ideal, it could then be in the social health insurance mechanisms so that family planning could be funded in our quest for universal health coverage that I'm seeing emerge in many countries. It's a very important question, and as FP2030, our advocacy team is leading how we could expand the narrative around it can be financed even though ODA is shrinking.
Yes, I completely agree. And thank you for the response, Samu. There's also much to be learned from other sectors who have been very creative in mobilizing funding and in creating a financing structure to be able to advance priorities. So I often say, we don't necessarily have to start from scratch. Maybe we have not seen all the creative and new ways to finance this work for our sector, but there's lessons to be learned from other sectors. And this piece on subnational, it really very much resonates. I wanted to share, and what came to mind is so much of PAI's partner work in advocacy and accountability around family planning and domestic resource mobilization is also at the subnational level. And I remember many years in partnership with KMET in Kisumu County in Kenya, the advocacy for the budget line item and to protect the budget line item for family planning during times of COVID came from the work at the county level and county level coalitions that then created this groundswell of support and pressure also for the national level to remain committed to family planning investments. So it just speaks to the power of highly local movements and being able to tap in and engage with the financing mechanisms locally. So Samu, around financing mechanisms, there's a question here, and sitting at the table, there's a question here in the chat about mobilizing civil society in a way that they are actually at the table. This came from a colleague in Uganda. So ensuring that grassroots community organizations, especially those that are working in underserved regions in key countries like underserved regions in Uganda, are not only included, but also very much part of informing future family planning funding strategies, just given the unmet need and the shrinking donor support. What is the role for those highly local grassroots organizations?
It is a great question, because we don't want to just say they should be at the table. They should define their own development agenda and own it. When it comes to funding, also, there are many, amongst FP2030 commitment makers, we've got about 10 countries that are almost on this path of self-reliance or self-sustenance, right? They are funding their own family planning programs. India is, Indonesia is, South Africa is. So how do we learn? What can we learn from those countries that these local organizations also could adopt and ensure they can run with? We are hoping that, one, they could use the made possible framing for family planning to ensure that their own local leaders, too, are champions of family planning. That is important. You mentioned Uganda, and we're really grateful for the partnership with the faith community there, because they are really championing at a local level family planning, ensuring that it can get funded and it can get financed. So I am hoping that through this campaign, anyone who is on this call, and I'm seeing many of these in the chat, take the message and have a conversation with your local community on what else family planning can do that can then attract funding. But civil society, and this is work that, we have been doing in Nabeeha around ensuring civil society is engaged, not only in accountability mechanisms, but in shaping the funding models for the communities where they belong. We should ensure there is catalytic funding for those civil society organizations. Honestly speaking, right now, many civil society organizations do not have capital, human capital or financial capital to continue the good work that they've been doing. So I am advocating for funding local civil society organizations who are going to ensure that this space is protected. But secondly, the agenda that they so dearly believe in, they are bringing to the table, not just the accountability to say, but you said you are going to do this. Where are we with what you promised we are going to say? I think they too can learn these innovative financing mechanisms. They are not like, I don't think you need to work on Wall Street for you to understand these financing mechanisms. They can be simplified for everyone so that when you understand them, you can actually rally the troops around financing to say, actually, it's not as complicated as you thought. Can we work together to ensure family planning can be financed going forward?
Thank you for that, Samu. I am seeing quite a few questions around, which is exciting, around learning from others, because clearly there's a lot of excitement to engage in Made Possible and leverage this for some of the ambitions and priorities at national and subnational level. So from a learning from others perspective, a couple of questions here. First is, how can those here and others find out who is engaging in the campaign currently, actively engaging in the campaign in other countries, so there can be a sense of collaboration? So how would a civil society organization or a research organization or someone sitting in the policy space find out who in my country or community is already doing something that I can link arms with?
Yes, it's a great question. And I think the team here, they've been putting some of the resources on the chart around how you could engage, how you could learn about the campaign. Do you know, Nabeeha, there are some global influencers, about 8 of them, and that those resources can be made available. You can actually follow them up on Instagram. You can follow them on LinkedIn and understand the work. And if they are in your local community, you could follow them too. There are, for many countries, we have actually done 18 country launches for the Made Possible campaign, and perhaps your country is one of those. So if you also go online for the Made Possible, in the Made Possible site, you could actually understand what has been happening in your country, tell your story, see who you can partner with. And if you still don't have those resources, please feel free to write to us. And if Monday, you could again pop the email here on the chat so that people can engage with us. We have also partnered with Nation Media Group in Kenya. They've got 30 media brands across Africa and 62 million social media followers. It was a successful launch that we had last week with the Nation Media Group. And we also held a training masterclass on family planning that actually is available online. And we hosted a 2-day summit that attracted hundreds of women across Africa. And I think because of these events, you are bound to find what is happening in your locality, and you can join, have a conversation. When all else is not, it fails, please reach out directly to us, and we will ensure we can link you up with those who are already involved and are doing activities in your local community.
Samu, building on this, and we didn't talk a lot about the regional hubs for FP 2030. So I'm going to add this to one of the questions that a colleague has asked us is, are there regions where we are seeing greater civil society mobilization around the campaign, or areas where FP 2030 is working to encourage more civil society, but probably also multi-sectoral mobilization? So talk a little bit about the regional hubs, but also where are you seeing the greatest activity and momentum that we can build upon?
Yes, so I wanted to just say that this campaign, Nabeeha, so we are almost like it's phase 1, right? Phase 1, you are activating, you want to see what works, and we are going to do an evaluation after Bogota, after the ICFP conference. So FP 2030 has got 5 regional hubs, and there's one where I am right now. It's a hub, but it's actually almost like our where we've got technical support and administrative support. We've got a hub in Latin America and the Caribbean. If there is anyone from the LAC region, it's based in Panama. They are really moving, you know, the civil society there, they are doing amazing things, especially with young people, with the LGBTQI community. There is actually an organization there called ACLA that is working with in Colombia, working with homeless women. They are doing amazing things in the Latin America and Caribbean region. We are seeing more commitments coming from that part of the world. And again, kudos to those who are coming from Latin America and Caribbean. I like all my hubs. Recently, I was in the East and Southern Africa hub based in Kenya, working with Nation Media Group, amazing. Anyone from Kenya, Uganda, Malawi, amazing. You know, people are unstoppable out there, Nabeeha. So I am really proud of the work that has been done in the Africa hubs, the Northwest Central Africa. We are still yet to do more in the Francophone regions, and we are hoping we can partner with OPCU and others in the Francophone region. So if there's anyone in the Francophone region, please shout out, let's reach out, let's partner and get this campaign to be out there. But we launched the campaign in Madagascar, again, working with UNFPA and other partners. It really, now they are asking Nabeeha, can we have the campaign at a sub-national level because it was so successful? So we are seeing traction in there. And we are also taking an interesting angle here in North America, where we are trying to get other global North countries to join the campaign, to make a commitment to FP2030, because as I said earlier, family planning matters, whether you are in Berlin, whether you are in Bulawayo, where I was born, whether you are in Bamako, it matters everywhere. So let's make this a global campaign. So if there is anyone from the global North countries, make family planning matter, because where we are right now, we know we need to protect what we have. Let's protect family planning. And so that's where we are, and we can actually get more people involved. And please reach out for more information. I see Jackie Katana, who is from Uganda, has also taken this campaign. It is flying in Uganda because she's working with the faith community and the civil society there to say, hey, before we start, you know what family planning can make possible? So much more. So I'm really grateful for the hubs and what they're actually doing. Asia Pacific, we recently had many op-eds and newsletters from Pakistan. They launched it there. They launched it in India. They are going with it in the, recently my team has, with the parliamentarians in the ASEAN region, they are actually launching the campaign. Oh, Nabeeha, it's so exciting what can emerge because of our decentralized model. We're seeing a different version of the campaign in each part of the world, which makes this a formidable global campaign.
Thank you so much, Samu. We're approaching time. I certainly want to make sure you have the last word in all of this. The one thing I will say is, you stated this, you've said so many powerful, inspiring, and very concrete things to carry all of us forward on this journey that is so urgent and desired, not just needed, but also desired. But one thing that stood out for me is ultimately we want a world where everyone has the power to decide. And there is so much that has been made possible by family planning. And I also want to say my heartfelt thanks to FP2030 and also to you, because your leadership has been so crucial in this moment. And we also have to recognize entities and donors and partners and governments and all who are on the call today, because collectively we are also making family planning possible. So with that, Samu, thank you for your leadership and for the space to share today. And I'll leave it to you for the last word.
Thank you so much, Nabeeha, for this opportunity. Nabeeha, let's just remind our listeners that family planning is economic infrastructure for women. And advocacy can be daunting. It can be exhausting, especially in these times that we are living in. But let's partner together to take family planning from the bedroom to the boardroom, because that's how powerful it is. And when I am looking at how we can get women to the boardroom through this, please continue to do it. You will irritate people, but continue to do it. At times you're tired, but energize yourself with get more ginger or whatever, be energized and do it. At times you're afraid, but just speak anyway. At times you're like, I don't know what to say, but just show up and make a difference. It can be daunting, it can be exhausting, but let's do it, tired or afraid, until we win and get more women listing their companies on NASDAQ and more women in the boardroom, because that's the power of family planning. Thank you so much, Nabeeha and team, for co-hosting this with us.
Thank you, Samu, and until we win.